Learning about proper skincare and skin disorder treatment is important for skin health. This week on The Good Life, we'll be discussing acne and eczema with the dermatologist Dr. Neil Persaud-Singh. I'm Amita Persaud-Webb, and this is The Good Life. Acne is said to be one of the most common skin conditions that affects both men and women, but with the right medications and skincare, it can be taken care of.
My name is Dr. Neil Persaud-Singh. I'm a dermatologist in practice at Nuttall Medical Center. Most of us get acne at some stage in our life. What we tell people is that very often teenagers get acne. About 85 to 90% of teenagers will get acne. Besides the teenage group, about 20% of adult females get acne and about 5% of men. What is heart-rending is that very often you meet women who have acne for their whole lifetime. What is interesting is that acne doesn't start until they start at the first period. Before periods, girls don't have acne. And most women, by the time they have their menopause, the acne disappears. But there's a small subgroup of women who at the time of the menopause, the hormones become in disequilibrium and they develop acne as a result. And we call this small subset mature women with acne. But the overwhelming majority of women who have acne is going to be in their teenage years. And the vast majority is going to clear up by the age 28, 30, right? But there are some people who keep on having acne all their life. Acne is really caused by the overactivity of the pilosebaceous glands. These are glands in the skin that secrete sebum. Now, as you may know, sebum is the oil naturally produced by our body that keeps the skin soft and supple and allows it to flex, okay? So that we don't dry out. Now, these glands are partially blocked off. The orifice of the gland where it comes out is partially blocked off. You get the overproduction of sebum by the gland and the action of bacteria on the contents of the gland. And this ends up in acne. I often tell people it is like the roads of Jamaica. You have a whole heap of potholes, a whole heap of traffic, and you have accidents. First of all, we divide acne into mild, moderate, and severe. And then whether it is inflamed or non-inflamed, okay? But overwhelmingly, a lot of people come in with acne in the mild stages, and you treat them with a topical preparation, benzoyl peroxide, and a wash, okay? In the very early stages. You might use 2.5 or 5% benzoyl peroxide, okay? And a sunblock. Later on, when it becomes a little bit more severe, moderate, we treat it with oral antibiotics and a cream like adapalene gels, Differin or Deriva, things like deoxycycline, minocycline or tetracycline. I like clindamycin, quite frankly, Cleocin. A scrub like Sastid or Cetaphil, and a sunblock. Then we come to severe acne, which we treat with something like Epiduo, which is a mixture of Differin and benzoyl peroxide, 2 drugs. We'd use more potent antibiotics, higher concentration for a longer period of time. In very, very severe acne, we might want to put the patient on a drug called Accutane, which stops the acne. It's the only medication that actually acts as a cure. Okay? And this is a pill you take every day for about 6 months and it gets rid of the acne. But before we put you on it, we have to do a blood test to make sure your cholesterol is okay and your liver is functioning good before we put you on this drug. And we have to give you some guidelines, okay? It's a very, very safe drug if it's properly used. You have to be aware that you cannot get pregnant if you're taking this drug, because if you do, you'll have to have an abortion. It affects the baby. Try to wash the face every day, right? Or twice a day. In women in particular, they have to remove their makeup at night. You can't go to bed with the makeup on. Good? Lots of our girls are good for that. I tell my patients to get some witch hazel, which is very cheap. Keep it in the fridge. Get a swab, a piece of cotton wool. After they wash their face, they wipe it with the witch hazel. Good? That will take off all the makeup. try and eat rounded diet with fruits and vegetables, etc., not the whole heap of fried foods like we normally do. And try and get sufficient rest and distress as much as possible. This thing called the cell phone is something that I am always worried about, because you'll find girls coming in with acne on one side of their face, and when you ask them, the face lives there. Now somehow or the other, the teenagers tell me that some law has been passed in Jamaica that say you can't live unless you have a cell phone and you're on it 24/7. So the phone is plastered here. You go into the traffic, you see them walking on the streets, not looking, crossing the street with the phone plastered here, right? And one of the key things I ask the kids to do is to take some alcohol and wipe the phone, okay? And wipe the face as well. Sun exposure is said to be good for acne in that the UV light is good for acne. And in the old days, you use UV light as a treatment in its own right. But I think we get enough UV light in Jamaica not to be burning up yourself with acne. So I tell patients, try and stay out of the sun, you know. I mean, moderate sunlight exposure is sufficient. As soon as you see the face start to break out, find yourself to a dermatologist and let them start treatment. This is because you avoid the problems with acne, the dark spots on your face. You'd be able to start treating that right away. The scars that people develop. People develop scars on their face, right? You get the ice pick scars, like little holes punched into your hole. You get depressed scars. Now, if you get them early, we can prevent all of that. Now, you talk about two types of scars. You talk about the actual physical scars you see, and then we talk about the psychological scars. Girls go through their whole life feeling, boy, I'm flawed. Something is wrong with me. People are not going to like me. Because they had acne and it should have been treated very aggressively and very early. Okay? And a lot of girls going through life and they're scarred because of the acne. What I call psychic scarring. One of the things about it is that a lot of women use bleaching creams. And these often contain steroid creams. It might be betnovate, dermovate, topisolone, other creams, right? And what these creams do is they control the acne to start with. And then when you stop using them, the acne breaks out. So you get a stronger cream to use, and that controls it. And then you stop and that breaks out, right? So they keep on using the creams for a long time. And this causes a particular type of acne called a steroid acne, okay? And usually, once you see the patient, you know what it is. All the acne are the same, looks the same in this particular condition. While in other types of acne, you have an evolution from the whiteheads, as I said, to the blackheads, to the open pores, etc. Go on. In steroid acne, everything looks the same. So this is usually a dead giveaway, okay? And you have to get the patients off the steroids. Now, a lot of them don't want to come off the steroids. And so you have patients coming and telling you, I want you to fix this face, but I'll not stop using the bleaching cream. And then come here for you to tell me to stop using the bleaching cream. And when you try to explain to them that the bleaching cream is what is causing the acne, they don't want to hear about that.
How safe is it to wear makeup on acne-prone skin? The answer when we return from makeup artist Carrie Spencer.